Good morning. This is Dr. McDaniel. I'm a board certified obstetrician gynecologist in New York City, and I'm bringing to you all things health related for women. Thank you for joining me at the corner today. And before I speak about the topic for today, I thought I would just remind everyone to please hit the like, subscribe, follow button, and to tell your friends and family, any women that you care about GYN Corner. Please make sure you check out the Facebook page, the YouTube page. I like the YouTube because everything is organized. You can go to videos and you can go to playlist and you can see videos all in the same topic or in a series. So that's really helpful for organization. And I'm on all of the podcasts, so Apple, Google, Shopify. I'm going nuts, not Shopify. Spotify. Spotify. So check out all the podcasts and to make sure that you tell loved ones to get the information that you'd like them to know to improve or to maintain good health. So let's see. Today I thought I would speak about breast because I've had quite a few people coming in the last couple of weeks about breast, and I've told several of them the same thing. So the big deal is a lot of women worry that they're wasting my time or they're wasting their time or that they're being over dramatic or jumping to conclusions when they come in with a lump or a breast mass or breast lump. So they say, I know it's probably nothing, but I just want to make sure that this lump is nothing and that it's nothing that I have to be worried about. It's been present for 2 months or 3 months. So the first thing I'd like to say is when you notice a lump, well, let me backtrack. The first thing I'd like to say is I tell everyone after 16 years old, definitely after 18 years old, the menstrual cycles should be regular. So everyone's hormones rise mid-cycle, 2 weeks before the menstrual cycle and during the menstrual cycle, and they should fall back down to a baseline or normal after the menstrual cycle. After the menstrual cycle, 1 to 2 days afterwards, everyone should just feel around on the breast to make sure that the breasts feel the same from month to month to month to month. So the self-breast exams are helpful because they allow you a moment to make sure that nothing has changed. So 1 to 2 days after the menstrual cycle, usually in the shower or the tub, simply because it's easier. You have the soapy water. You can just wash your breast a little more conscientiously than usual. Just press around. You're not feeling for lumps or clumps. You're simply trying to make sure how your breasts feel this month was how they felt the month before, that nothing has changed. So if you do the self-breast exams every single month, you'll notice straight away if there's a difference between 1 month and the other because you'll have an idea in your mind of what you should feel. You'll have an expectation. And if the expectation is not met or if what you're used to feeling isn't what you actually feel, then you should come in and it'll be that 1 month. You don't want to have 2, 3, 4 months in between the breast exams because A, it's harder to remember how your breast felt if it was 4 or 5 months ago that you last checked them, and B, you don't know what that lump is going to turn out to be. If it's nothing, it's just a hormonal cystic change, then you're good. That's what you want. But if it's something, then you'll want to have it addressed as soon as possible. Having it sitting there for 3, 4, 5 months is not as soon as possible. So I've had several women in their 20s and 30s come in saying that they don't think it's anything, but it's been there for 3, 4, 5 months, so they want to get it checked out. Yes, you're right. If it's been there for 3, 4, or 5 months and it's a little bit smaller than it was initially, then you're right. It's nothing. It's a hormonal change. So I wanted to speak on hormonal changes today, and then the next presentation I'll speak on non-hormonal changes and what's often recommended and what to expect. So as I mentioned earlier, everyone's hormones rise and then they fall. They rise 1 to 2 weeks before the menstrual cycle and they fall once the menstrual cycle is over. That's due to ovulation. So the first thing you can do if you notice that you have a change that's flared up Say it's tender, it's a really obvious lump, your breast cup size, the bras are too tight before the cycle, then if it's really cumbersome or bothersome, or it's really just a huge inconvenience in your life, you can go on medications that prevent you from ovulating. If you don't ovulate, you don't have the surge in the hormones. You don't have the surge in the hormones, you're not going to have the lumps, the clump, and the tender changes. And medications or hormones that prevent you from ovulating are contraceptive methods. If you don't ovulate, you don't have an egg that gets produced. No egg that gets produced, no pregnancy. No egg, you can't get pregnant. So birth control pills, the patch, the NuvaRing, or the shots, or the implant. So the pills, the patch, the ring, shots, or implants, those are all medications that will prevent you from ovulating. The IUD, even the hormonal IUD, you will still ovulate. So that's why one can still potentially get pregnant on an IUD, because you still have an egg that's floating around every month. Now, if you aren't usually bothered with ovulation symptoms or premenstrual issues, and you just randomly 1 month you notice you've had a lot of symptoms, if the symptoms flare up 1 to 2 weeks before your cycle is due, then yes, you can wait till after the menstrual cycle, give it 1 or 2 days after the menstrual cycle, feel around in the shower tub, or some people do it if they're putting lotion on, and see if the breasts feel the same this month as it did the month before. If they do, the lumps, the clumps, the tenderness, everything went away when the menstrual cycle went away, then you're fine. It's hormonal. We call those hormonal changes fibrocystic changes or fibrocystic breast disease, or the technical term is cystic mastopathy. It's the same thing, just a rose still a rose, tomato, tomato, different words to say the same thing. Lumps, clumps, and tender changes of the breast that rise when you ovulate, and they decrease or go back to normal once the menstrual cycle is over. So if you do the breast exams every month, and 1 round a month you notice in the shower tub just per chance that you have a lump or clump, you haven't had a menstrual cycle, then yes, you can afford to wait till after the menstrual cycle, do your breast exam, see if it's back down to normal. You're fine. You don't need to come in. I've had women come in after it's gone down, and they say, well, I noticed a lump before this like 2 or 3 weeks ago. After the menstrual period, I didn't really notice it, but I want to check it out and make sure that's really gone. You can do that if it gives you peace of mind, but if you're doing the exams every month, you notice it flared up randomly, you're in the shower, you do the exam and you don't feel it anymore, or it's back down to normal, then you don't really need to come in because it's gone. So I hope that's been helpful information on lumps and clumps that rise and fall or come and go. And then the next presentation will be a different topic about breast lumps. So thank you for joining me at the corner today. This is Dr. McDaniel. Please hit the like, subscribe, and follow buttons to get information straight away when I have a presentation. And then check out the YouTube and the podcast. I'm on all of the podcast platforms. I have over almost 300 presentations on YouTube and all the podcasts, so you can go back in history, check out the information on those presentations. Have a great rest of your day. Bye.